Hey guys, so I've been planning on making this video for a little while, so it'll probably be one of a number of videos I make about my journey undergoing bariatric surgery. So this video is kind of to talk about what led to getting here, as well as talk about the fact that it is coming up rather soon. My surgery date is now for November 3rd. That was in a little bit of question as COVID has been badly impacting elective surgical care in my area. And so we weren't quite sure when we were going to get the green light to book it. And now we have it on the books for November 3rd. So let's just talk a little bit about my journey with weight. Like many people who undergo bariatric surgery, the weight gain was gradual, and even when it was appropriate to start considering bariatric surgery, the process to mentally get there was gradual. So anytime you're making a big life decision, I think we kind of have to have a number of come to Jesus moments where we realize that barring a dramatic decision, we're likely going to be stuck with a set of circumstances we're not entirely happy with. And for me, while my weight has increased significantly over the past 10 years, I would say since I graduated med school, I've probably put on close to 100 pounds. There's obviously been an up and down with that, where I would have times where I would lose a fair bit of weight, and then there would be times that I would put it back on. And overall, though, there's been a gradual increase over that amount of time. Certainly, as we get older, losing weight doesn't become any easier. And for me, the biggest impetus to get to bariatric surgery was not cosmetics or necessarily feeling quote unquote fat. It really was seeing the secondary health issues that come with obesity. And those issues really started to scare me. So over the past 3 to 4 years, have started taking blood pressure medication, see that has required more and more effort to control, to the point now where I'm on 3 medications just to control my hypertension. Have been diagnosed with severe sleep apnea in the past 6 months. Actually had a sleep study about 7, 8 years ago. Didn't have sleep apnea at the time, but had a sleep study recently which showed severe sleep apnea, where in an hour I was ceasing to breathe about 30 times per hour. And so started wearing a CPAP. And while that definitely has made me feel better, there's also this. I'm 38 years old and I don't want to be on a CPAP for the rest of my life. And while bariatric surgery doesn't guarantee that you'll come off your CPAP, there's definitely a high probability that you will if you meet your weight loss goals. So for me, it's been a number of health issues start to stack up, as well as just not being able to do things that I previously was able to do. Limited ability to run, chase my kids around the yard, chase my kids around the house. All those things have become more challenging. We actually just got back today from a trip to Dollywood, and just walking around the park presented some challenges. I was able to do it, but just did not feel like myself and did not feel how I wanted to feel. So this really got to where it was taking a big mental toll. And so I've hoped for a long time that, with a combination of a trainer and the right dietitian and the right program, that I would be able to do it on my own. But now with the amount of weight I need to lose to get to an ideal body weight, if you look statistically, the odds that I can do it without some type of procedural intervention are well under 10%. And so I'm just at the point where I'm tired of feeling less than my full self. I'm tired of being the size I am, continuing to increase the size of clothes over the years. And so for me, it really wasn't the cosmetic aspects as much as it really was, I'm 38. I want to be a healthy 38-year-old. And obesity, as a physician, I know impacts every body system you can imagine, and in a negative way. So it's just become more and more obvious that my health is taking a serious impact because of my obesity. My odds of getting the weight off without a surgical intervention are low. And so I have come to develop a relationship with one of the bariatric surgeons where I currently live. Have a lot of confidence in him, see the great things he does for his patients. And so that's made it easier having an individual that I know personally and have a lot of trust in. I realize I'm privileged to, to have that relationship, which has been facilitated by me being a physician myself. Uh, so what have I learned in this process? So one, the treatment of obesity in America is a huge problem that needs a lot more resources put behind it. And the process to get to bariatric surgery, while you wouldn't necessarily want to make it easy, it shouldn't be prejudicial in who it screens out. I've had to spend a lot of money just for the preoperative workup, which includes psychology appointments, which includes psychological testing, cardiac imaging in my case. It's included having upper endoscopy. All of these things, especially when you have a fairly high deductible insurance plan, lead to a lot of out-of-pocket costs, which just become prohibitive for a lot of people. And that's something that we really need to, as a society, work on and increase access, because surgery for being obese should not be limited to those with more resources. That really is unfortunate, but that's often how it works. There are also insurance plans, while this is decreasing, which are much less cooperative in assisting their patients get bariatric surgery. So I'm excited about what's coming ahead. We're only a couple of weeks away now. I would say, in addition to being excited, I have some fear. I think that's normal. While it's a very, very safe surgery, there is some unknown that comes with it. So I will be dealing with that. There's also a little bit of a mourning process in that, for me, food's been a very big part of how I celebrate events, how I cope emotionally. And so not having that brings some fear. I'm in recovery from opiate dependence, and so some concerns about how my postoperative pain control will be managed. I have a lot of confidence that we have a plan in place for that, but also there's some fear about that. And just a quick word on why I chose a bypass as opposed to a sleeve. So I have fairly significant gastroesophageal reflux disease. The sleeve procedure has been shown to increase reflux in many patients. And so there's a significant risk that will be worsened if I got a sleeve. There also seems to be some additional benefit from a weight perspective with bypass. So while it's a little more drastic in terms of what it requires procedurally and what it requires for follow-up, it's definitely seemed like the right move for me. So I will keep you guys updated on this journey. Like I said, excited, scared, want to share my story, and hope I can encourage others to consider this if it might be right for them. So if you have any questions, put them in the comments. We'll be glad to interact with you folks.